Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor. And over the last 17 years of treating cancer patients, I've always asked patients what symptoms led to the diagnosis of your cancer. And I have to tell you that I keep on hearing the same symptoms time and time again. So guys, we need to know these symptoms. And I'm going to share the most common today, right now, with you. So with that being said, the first thing I want to ask you is to please read my medical disclaimer. Just know that this video is for educational purposes only. So the first thing I want to tell you is that the majority of these symptoms are not due to cancer. So I don't want you to panic because the grand majority of the times, these symptoms are not due to cancer, but sometimes they are. And that's what I want you to keep in mind. And also, every cancer is unique. None of them have a very specific symptom. Everybody's different. So you also have to keep that in mind. All right, so the first symptom we are going to go over is a headache. And of course, headaches are common, and the grand majority of the times they're not due to cancer. But just know that brain tumors can cause headaches. And I've noticed patients tell me, you know what, this headache got worse with time. For the most part, when they wake up in the morning or in the middle of the night, the headache tends to be worse. It's also associated with nausea, vomiting, or visual disturbances, or they're unsteady, they have balance issues. I've also heard of a headache associated with weakness in one arm or one leg. So it's not a symmetrical weakness. You have to think of the possibility of a brain tumor. Now, I can tell you that migraines or other causes, issues with your vision are much more common causes of headaches, but just know that brain tumors are a possibility. Fever. There is a thing called a tumor fever. And if you have a flu, if you have an infection and you have a fever, then it's explained. But if you have an unexplained fever, you have these fevers that come and go, you do not have an infection, you have no clue why you have this fever, just know that cancer can cause fever. The other one is fatigue. Now, fatigue is very common. I worked all day. I saw a ton of patients. I'm fatigued right now. But if you have a fatigue that is new, it's different than what you're accustomed to, just know that fatigue is very frequently seen in cancer patients. I can tell you that a lot of cancer patients complain of fatigue. Although, again, fatigue is very common and it's usually not due to cancer. Pain. For the most part, pain is usually seen in an advanced stage of cancer. For example, when you have cancer in your bone, but pain is a symptom or a finding in cancer patients. So if you have new onset pain or a pain that you cannot explain because you do not have recent trauma, you did not hit yourself or fall down, so why do you have this pain? And the pain usually gets worse with time. So you notice this pain is not getting better, it's getting worse. Get yourself checked out. Weight loss. Of course, we all know weight loss could imply an underlying cancer. And for the most part, it's an unexplained weight loss because, of course, if you're exercising, if you're dieting, if you're eating healthy, that weight loss is anticipated. It's expected given your circumstances. But if you are losing weight and you have not changed your diet, you're not exercising, or you're exercising the same amount and you're losing a lot more weight than what you're used to losing, guys, this could imply that you have something going on, and this thing that's going on might be an underlying cancer. I've seen it quite often. The usual complaint is they've lost 10, 15 pounds over 1 to 2 months. You have to get checked out, especially if it's unintentional. The other thing is weight gain. This one's much less common, and I'll tell you where I've usually heard it, and that is in ovarian cancer. Women with ovarian cancer, for the most part, ovarian cancer in its early stages is asymptomatic. Women feel great. Now, when that ovarian cancer starts to grow and spread and produces what they call acidic fluid, or that liquid or water that accumulates in your abdominal area, that fluid weighs. It has a weight to it. That cancer is growing. So a lot of times women will complain of weight gain. Also men with other types of cancer. But if you've also noticed that along with the weight gain, you're having issues buckling your pants, or just your waist circumference is increasing, think of the possibility of an underlying malignancy. Much less common. Weight loss is much more common, but weight gain I've also heard of. Jaundice, that's when a person turns yellow. Usually starts with the eyes, the sclera of the eyes turns yellow, and then the skin starts to turn yellow. Just know jaundice is not normal, should not happen. A lot of things can cause jaundice, and cancer is one of them. Usually cancer within the liver, the biliary tree, the gallbladder, the pancreas. Usually the area is in that right upper quadrant, right upper side of the abdomen. And if that happens, definitely get checked out. Difficulty swallowing. Cancer of the head and neck region, the mouth, the esophagus, the stomach. Multiple patients have told me, you know what, doc? I started having issues eating solid foods. For example, red meat is the one that I usually hear of. And then it got worse with time. And then it even got to the point that drinking fluids became a problem. And a lot of times, along with that difficulty swallowing, patients will tell me, you know what? I started coughing when I was eating or drinking. And that usually means you're aspirating. So that coughing at the time you're eating, together with the difficulty swallowing, get yourself checked out, because it could mean you have a cancer of the upper GI tract. Bleeding, very, very important. Just know that bleeding is not normal. You should not bleed. Now, a lot of bleeding is common, and it's usually not due to cancer. But if you're coughing up blood, just know lung cancer can do that. A lot of other cancers as well. But if you're vomiting blood, gastric cancer, esophageal cancer. If you're bleeding in your urine, just know that kidney cancer, bladder cancer frequently does that. The same as if you're bleeding in your stool, colon cancer, which is so common. Now, for example, bleeding in your stool, hemorrhoids, diverticular bleeds, there are many reasons for bleeding in your stool, which are much more common, but just know that colon cancer is also one of them. So bleeding anywhere, you have to get worked up. The other one, which I hear of all the time, and it amazes me how sometimes women wait a long period of time before they seek medical attention. A postmenopausal woman should not be bleeding. Your menstrual cycle is gone. So if you have the vaginal spotting, usually it's that pinkish fluid, that's what women describe to me. Or if you're having just frank vaginal bleeding, postmenopausal, get yourself checked out, because cervical cancer and uterine cancer is or could potentially be the cause. The other one is a non-healing ulcer or a lesion. I can't tell you how many times patients have told me this. Think about this. When you hurt yourself or you burn yourself, how long does it take for that to heal? A week? 2 weeks? Well, if you have a skin lesion or a lesion in your mouth, your tongue, and a month goes by, 2 months go by, and it has not healed, you have to think of the possibility of a cancer. I'll tell you what, almost every single time I see a patient come in and they tell me, you know what, I have a mouth lesion or a skin lesion. It's been 2 months and it has not healed. It's usually cancer. So please, if you have one of these non-healing lesions anywhere in your body, including your mouth, get yourself checked out. Voice changes. Just know that your vocal cords, the nerves that power or innervate your vocal cords have to pass through your mediastinum, which is around your lungs. And lung cancer, cancer in your vocal cords, all these types of cancers in these areas, lymphomas, cancers of the thyroid. I've seen all these cancers cause voice changes. So if you notice voice changes, and the complaint usually is that the voice starts changing, usually it's very subtle, and then it gets worse with time, consider the possibility of a cancer. And it's actually quite easy to diagnose a lot of times, because a simple scan or the ENT can put a little camera down your nose and check the area out, your vocal cords, and you're done. The last one are lymph nodes. Last but not least, and I have to tell you, this is another big one, together with, for example, bleeding. I see this all the time. Now, we all have lymph nodes, and lymph nodes swelling up are common. When you have a cold, a flu, for example, a tooth infection, acne, These things can cause the lymph nodes to swell up. But if you have lymph nodes which are not improving, they're continuing to grow, especially if they're greater than 2 centimeters in size. They're fixed. In other words, they're not movable. You know, they're very fixed. They don't move. They're not getting better. They're unexplained, meaning you did not have a flu, a cold. You did not, or you do not have a tooth infection. Why do you have a lymph node? You have to get yourself checked out. Lymph nodes in the neck region, under in your armpit region. I can't tell you how many breast cancers were diagnosed with the first finding was a lymph node in the axillary region or the armpit. Men shaving, they find a lump, and next thing you know, they had either a lymphoma or a cancer in the head and neck region. You need to get these worked up. And always know and remember that a lymph node above or below your clavicle or your collarbone is not normal. You should not have a lymph node above or below the clavicle. So if you do, get yourself checked out. As always, remember your colonoscopies, your mammograms, your pap smears, men, your PSA tests, because the whole goal is preventing the cancer in the first place. So I really do hope this helps. I can tell you over the last 17 years, I can't tell you how many cancer patients have told me that these were their initial symptoms. So I hope this really helps you out. If it does, consider subscribing. It motivates me to make other videos, and I'll catch you on the next one.